Hello and welcome to Healthy Living. I'm Dr. Donald Pelto, and today I have Prashanth Bala. He's from the Surgery Center in Shrewsbury. So welcome to the show.
Thanks for having me, and thanks to the viewers for allowing me to be here and join you for the next 30 minutes or so.
Yeah. So we're going to talk a little bit about surgery centers, and specifically what is an ambulatory surgery center? That's what you manage, or you're taking care of. So tell me, what is a surgery center?
Yep, so the Surgery Center is our surgery center in Shrewsbury, Massachusetts, so right across the lake here. And it is a joint venture partnership between UMass Memorial, Reliant Medical Group, and Shields Healthcare Group. Okay. So 3 different owners, 3 different great healthcare providers coming together to provide that extra added benefit to the community. Our surgery center is a 9 operating room surgery center, and it specializes in musculoskeletal work. So starting with orthopedics, we have podiatry, we have plastic surgeons who deal with the hand, as well as some cosmetic and reconstructive cases. Some pain management, and we started doing some sports hernia, and then that translated into doing some more work in just general surgery work as well. Okay,
so tell me about the surgery center, how you got involved in surgery centers. You've been in Massachusetts for a few years now.
Yeah.
But you've done this in other places, and tell me.
Absolutely. So I think healthcare is constantly changing. There's a landscape in which the providers, be it the hospitals or the insurance companies or the patients, are just seeking different ways to gain that health care. And we're seeing it on a national level where patients are shopping for health care. And one of the ways in which they're able to do that is try to find something that might be a lower cost, same high quality, but really just a little bit more convenient. And what you're seeing is that's where ambulatory surgery centers come in, where it's the same high quality, you have the same surgeons that do it at the hospital, same anesthesiologists that you might see at the hospital, are just doing it in a location that's just a little bit more convenient. Our surgery center in Shrewsbury, for example, is right off the highway, easy to get to, easy to check in, easy to register, and so on and so forth. And so it's just sort of a lower cost, same high quality form of healthcare that's being adopted across the country. And now we're able to bring that to you in Massachusetts.
Okay. And you said some of the specialties. Let's talk about some of the procedures. Are there longer procedures? Are there procedures where people stay overnight, like a hospital? Or kind of explain what's the selection?
Sure, absolutely. For our surgery center, we do not keep anybody overnight. Okay. There is a regulation that the state can impose that a surgery center can keep somebody for 23 hours. And so from the moment they check in to the moment they're discharged, they could stay for 23 hours. We do not. We perform surgeries in which we want to get you home today. And so if you come in, you check in, you have your surgery, we try to keep you for 1 to 2 hours, depending on how you feel, and then you'll go straight home for your recovery. There are surgery centers across the country that might keep you overnight, but that means that they're doing much more complex surgeries. So our surgeons, our facility, we do things that are a little less complex. But we start with the least complex, which might be a trigger finger or a carpal tunnel surgery on your wrist. Pretty routine surgeries that you can have and go home right away. Then we get into a little bit more complex ones like a rotator cuff. If you're doing an e-scope, you might have an ACL reconstruction. And excitingly, in December, we just started doing total joint surgery where we did our first total knee surgery. And that patient too went home. And they recovered really well at home with a nursing service that would come home and take care of them there. So it's just an exciting sort of evolution of the way healthcare is going. Technology is better. The care is better than it was maybe 20 years ago. And so we're seeing that the ability to do this work in an outpatient setting where you can manage your recovery and you can do it just as well as if you were to be at a hospital for these routine cases, not the complex ones, the routine ones. Yeah. You go home, you recover just as well. And so it's back to that idea of convenience. You're able to just recover in bed, on the couch, in the comforts of your own home. Yeah. Now,
in terms of the procedures that they do there, what type of patients does it have to be a healthier? If some people are watching this here in Worcester and they're saying, I'd like to maybe consider my surgery at the surgery center, can they just go to the surgery center and say, I want to do surgery here, or how does that work?
That's a great question. So the first thing you'll need to understand is if you have an injury or something that needs to be operated on, you're going to find your surgeon. And we have a great group of surgeons here in Worcester County, mainly out of UMass Memorial and Reliant are the ones that come to the surgery center, but there are great surgeons here in Worcester County, so you can find great quality care right here in Worcester. And those patients would find a surgeon, and through that surgeon, the surgeon would determine if they need surgery or not. that surgeon, if they have privileges at the surgery center, might choose to bring that patient to the surgery center. And a couple things would be taken into consideration. The overall health of the patient. Are they healthy enough to be able to own that recovery and go home and have that care done there?
Is it safe?
Is it safe? Yes, exactly. And then there are a couple of regulatory restrictions. Age. Our surgery center sees patients that are 12 years and older. And so not every patient is 12 years and older. And so as a result, we see only those that are of that age group, and if they're healthy enough to have that home recovery and they can own it themselves. But again, but that's such a large age group, right? So 12 and older. And so we see a large number, and you could probably look at it from a 95% of the sports medicine, hand surgery, some of the plastic surgeons, and podiatrists, they can bring their surgeons or surgeries to our surgery center.
Do you tend to give preference to quicker surgeries, or can you do as a surgeon myself, sometimes there are cases that are 3, 4, 5, 6 hours,
Sure.
or do you give preference to half-hour cases? Is there a preference, or it doesn't really matter?
There isn't a preference. I think our number one motivation here is to provide a great service to the community. And so we want to have the community be able to access care quicker. And so we're able to offer a podiatrist who might need to do a 5 or 6 hour surgery, or a carpal tunnel or trigger finger that's only 30 minutes. We are able to provide that gamut. But it also comes back to the surgeon's comfort. Do they want to have that patient who needs 5 to 6 hour surgery go home right away? Probably not if it's 5 or 6 hours worth of surgery. They might stay overnight at the hospital to just be observed and just make sure everything's going well. But we do have cases, an ACL reconstruction, a rotator cuff that can take an hour and a half, 2 hours, 3 hours. Some of our larger plastic surgery cases, they can take a few hours as well. And so the goal is just to ensure that the patient's comfortable, the surgeon's comfortable doing the case there, and the patient recovers well in our facility before they go home to recover further.
Let's talk a little bit about this whole idea of total joint surgery. It sounds very interesting. Why is it so special that you can now do total joint surgery there? I know the answer, but I'd like you to share how does it differ in the past and why you can do it now. Are there certain considerations or precautions you need with total joints?
Absolutely. So, the first thing to point out is not every patient is eligible for total joints, number one. Not every patient is eligible for an outpatient total joint. And what we're seeing, though, is across all of healthcare, the techniques have gotten a little cleaner. Anesthesia has gotten much better. And that allows, therefore, and pain management, I should add, gets a lot easier to manage. And so as a result, you're seeing patients that used to have what would be considered a 5-day stay in a hospital, then to 3 days, and now is to 1 day, able to go home and recover with some attention and needs at home. And so that's what we're seeing that the total joint surgery is just the next iteration of procedures that once upon a time required lengthy stays at the hospital are now being able to be performed. Pain is managed. And as a result of that management, the patients are able to get up, start moving, manage themselves the same way they might say an ACL from 20 years ago.
Yeah.
Those used to stay at the hospital. Now, it's rare that you'd ever see an ACL ever stay at the hospital. And so we're going to see that trend continue to happen, and total joints just seem to be the next sort of iteration of that, where today we might perform 10 to 15% nationally, total joints in an outpatient setting. In the next 3 to 4 years, you'll see that creep up into the 2025. And then in 5 years or so, we'll probably see 50%. 50% of those procedures, 50% of those patients will be healthy enough to have that done in an outpatient setting. And when you look at it from today's perspective, only maybe 10 to 20% of patients are eligible to have it done today in an outpatient setting. So it's not everybody. It's the right sort of characteristics of the patient, right home setting. And a couple of things that we'll go over doing our preoperative education class that we offer those patients that have surgeries with us is sort of a group setting, a small group setting where you can interact with our nursing staff and physical therapy, and they teach you everything you need to know about how you're going to recover at home. So those expectations of what to do before surgery, during surgery, and after surgery are all laid out, and so patients are much more educated and equipped to take care of that recovery.
That's great. Let's talk a little bit about this process. Let's say the person that's watching this, they go to their doctor, the doctor says, we're going to do outpatient ambulatory surgery. and then they make the appointment. You know everything that's going to happen. Tell me about everything. Do you guys call them to confirm, or does the doctor do that when they come in? Do they have to come in a day before to review and do a tour, or do they just? So tell me kind of, and then they go in. What are the rooms like? The waiting room, and
Absolutely.
family, kids, things.
Absolutely, and so we manage this in collaboration with the surgeon. So the surgeon's going to meet the patient in the clinic and determine, yes, you're a candidate for total joint surgery, you're a candidate for outpatient surgery, you're a candidate for outpatient at the ASC, so the surgery center. And so they're going to send us that information to the surgery center when they book that case. Our staff will then take that, start working up the package of who is the patient, what's their contact information, and then from a surgery perspective, what do we need to do to perform that surgery? Mm-hmm. Our staff will then take the information of the patient and then start contacting the patient. The number one thing that we're going to do with the patient is want to make sure that they register, just so we have a history, everything we need to know about the patient from a historical perspective and their physical condition, just to make sure they're safe.
Paper forms they fill out, or is it online?
We actually have an online mechanism. So patients will get some information from the surgeon's office. It's a little card with a login information. They'll go online at their convenience, again, back to convenience, log in and fill out the information. Now, if they needed some help, they're more than welcome to call us, and our nurses will walk them through that so that they feel comfortable. And so once our complex care coordinator gets that information, she'll make the first phone call to the patient and start introducing herself, introduce the facility, and make sure they're comfortable. About 2 weeks, maybe a month, depending on how many cases we have for a total joint surgery, we'll have the patient come in for an education. That's called our preoperative education.
For everyone or only total joints?
Right now it's for only total joints. Every other surgery, as you can imagine, today is just considered routine. And so that level of education happens in the clinic, happens over the phone, happens over YouTube. And so our patients are so immersed in that education and knowledge today that we provide just that little bit of extra knowledge and education for those patients that are doing total joints. Good. And so they'll come in, they'll have about a 1 hour, 1.5 hour course with the nurse that'll be seeing them through the process, our complex care coordinator.
That's nice.
We want them to feel that continuity of care from the first phone call to when they check in, they see her again. They might even see her as she's taking them to the OR and then back into recovery. So they just feel comfortable as we're starting to grow that program for those patients. And so it's exciting for them because they get to see and hear and feel everything about their surgery. Sometimes it could be sort of, you're going to have surgery and we'll see you on the day. But here we try to give that added benefit of, we'll talk to you. We'll give you this course for total joints. And if you're having another surgery with us, different than a total joint, we still call you. We still talk to you. We still do a preoperative phone call with you. We still ask you to register online. And our nurses will call you if they have any questions on what you might have provided on that online registration. So we're excited by that sort of constant contact with our patients, making sure they're safe, they're comfortable, they understand what's going to happen. We have information on our website, and so they can find out some more information there. They can see who our surgeons are if they're shopping for surgeons as well. They can see which surgeons come to our facility. And so we want to put the power back into the patient's hands to say, this is your care, find the right surgeon, find the right facility, and let us help you through that process.
Perfect. So then you get all of them registered. It's the day of the surgery. They come in with family. Where does the patient go? Where does the surgeon go? Where does the family sit? And tell me that whole, they go in and out. I've done the rounds there, so tell us.
Absolutely, and I'd love to provide some photos that we'll show here as well. But the moment you drive into sort of our campus, if you will, is simply the free parking. So you get to show up and park right there, right in front of the facility. Yeah, you walk in with your family, and the first person you'll be met with is somebody at our front desk, and they're going to have a lovely smile. And they're going to welcome you and encourage you to come fill out the last minute information that we have to go over with you. And then you and your family member will have an opportunity to sit, if it's sunny, a nice sunlit waiting room. Very comfortable. A lot of our patients and their family members feel like it's more like a hotel than it is a healthcare facility. And we sort of have an unwritten rule where we like to see our patients come back to their pre-op to get their process started within 15 minutes. So again, back to that convenience. We know you're there. We know you chose us. So we want to make sure that you're continuing to go through your process and that we're on time. If we're unable to meet the 15 minutes, then we owe you an explanation. We'll come out and talk to you and explain why. So let's say you come back within 15 minutes. Your family will stay in the waiting room until they're ready to come back. And there's access to a cafe where we have vending machines, or we have free coffee, tea, water, hot chocolate, only for the families and the ones waiting. And we also have a patient tracking board. So if they do stay in the lobby in our waiting room, they can see where their loved one is in the process throughout the day. And so the patient will go into the pre-op section. We've built our preoperative bays to look exactly the same as everyone. So our staff can feel like if they're in this bay, it's the same as this bay. And so they don't have to get confused on where things are.
Everything's identical.
Everything's identical so that their 100% focus is not on where things are, but on the patient. So when I give the tour or show folks around our facility, I oftentimes say families will sit on the left, staff will sit on or work on the right, and the patient's figuratively and physically right there in the center. And so they have the utmost attention of everybody in that room. And so what we can do is you'll pre-op in that bay, go to the OR, and then you can come back to our recovery, which it looks exactly the same, so it feels like there's continuity of care. So our recovery staff will pick up the care there. They'll take the handoff from the operating room nurses, and they'll begin their recovery work with the patient. And from there, we have a separate discharge. So family members will be able to come drive in through another canopy that looks just like the front, but a separate exit so that patients can comfortably wheel straight into their car and, again, comfortably go home.
And do patients come in preoperatively and postoperatively? Can they come into the back, or do they sit out in the waiting room?
So patients will come straight. So patients will come to pre-op and then come into to the healthcare section of the facility for pre-op, OR, recovery, and then go out. The families will come into pre-op, and then if their loved one is done and ready to go home, they'll come check back into the front desk, and then that same nurse that's recovering the patient will come out, get them, and walk them back to exactly where their loved one is. So we want to make sure that everybody's comfortable through the process.
That's great. And then in terms of you said all the bays are exactly the same. Are all the ORs the same, or do you have some ORs that are made differently for different procedures?
That's a great question. So we've actually built our facility for the future. We recognize that some of today's cases are no longer going to be cases that need to be performed in an operating room, but can be performed in a clinic.
Okay.
And so we're looking to the future of what are those next new total joints that are going to come out. If you look at some of the literature today, if you can believe it, you're starting to see spine cases come out of the hospital and come into an ambulatory surgery center. You're starting to see cardiac cases come out of the hospital into a surgery center. So we've built ourselves for the future. We want to be here for the community and be able to provide that same level of convenience and quality care, no matter if it's 2019, 2020, up to 2050 and beyond, right? So we want to be there for everybody. So that's the long answer of they're all the same, but they're all relatively large compared to some of the ones you might see elsewhere or at some hospitals, because we had the benefit of being a brand new building.
Yep.
So we were able to build our operating rooms relatively bigger. Some of them are off by where the columns might be in the building by just a matter of feet. So they're all designed the exact same way, so our staff, again, nobody has to wonder where something is. They know exactly where things are, so their focus and attention is always on that patient.
That's great. And now let's talk a little bit about insurance, because insurance these days is a concern of patients. There's so many different types. There's Medicare, there's Medicaid, there's Blue Cross, there's Tufts. Can anyone with any insurance go there? Do they have to check with their insurance? How does that work?
So yeah, as with all insurances, you should always check with your insurance. You always make sure that your insurance is covered, or you're covered for that procedure, that you have the authorization, and we call it prior authorization. So being prior authorized to have that surgery with that surgeon as well as at that facility. So we definitely advocate for every patient to own that process and make sure that they're not going to be left with any surprise bills, if you will, with the insurance companies. But it's a simple phone call your insurance companies and find out. We are, as a result of being owned by Shields, UMass, and Reliant Medical Groups, partnered with almost all of the insurance companies that they are partnered with. So if you have it and you go see one of their surgeons, they're more than likely going to be able to bring that case to us. And so it's seamless. It should be seamless from that perspective. We definitely encourage every patient to contact their insurance company first to ensure that they're authorized to have surgery, as well as to have that surgery at the surgery center. And we'll do the same work. If your case is booked with us, we do that same level of checks and balances, where if you're booked with us, we'll just double check. We have a group of fine people from our patient services department that will interact with the patient in terms of that insurance conversation too, or help them through the process if they need it.
Perfect. So, and tell me about, in terms of your involvement in the community. Have you guys get involved in the community in any way, in Shrewsbury or in Worcester or things like that? And I think I remember some things, the staff, some baseball games I remember hearing about.
Yeah, absolutely. So we are definitely here for the community. If you come through the facility, one of the things you'll notice is that there's no artwork. We're here for the community. All you're going to see on the walls are the jerseys of the schools and teams that we take care of. And so we're here for the community, we're about the community, and as to be a part of the community, we actually have a softball team in the Shrewsbury Rec League. We are the smooth operators, and so, if you're ever by Dean's Park, come stop by and cheer us on. It's all about having fun and all about being about the community, and so we're excited to be in Shrewsbury, we're excited to be in Worcester County, of course, and looking forward to meeting more folks around town. And we hope to meet everybody. I oftentimes say when I see a patient leave, we hope we never see you again. But if you have to have surgery, we hope you choose us. And so, surgery is typically that last option. But if you have to have surgery, I hope you choose us at the Surgery Center in Shrewsbury, and we'll take really good care of you.
Well, as we're concluding here, is there anything else that you'd like to tell the audience? And if not, just if they want to learn more, how they can learn more about is it the website, or if they can come in for a tour? What do you recommend?
Yeah, I definitely recommend taking a look at the website. Our website has a lot of educational material that provides patients, other referring providers, primary care physicians, if they're looking at that as well, to ensure that they have information about what we are, what we do. And then they have contact information there too to ask questions. Do you do this procedure versus this one, or what specialties do you take care of? So definitely the website. We encourage everybody to visit that. We also encourage everybody to start asking the questions of your providers. Do you have the capability of providing surgery at this facility? I think healthcare today is one of those which you can shop for. You can choose to stay here in Worcester, you can choose to go to Boston, you can choose to go almost anywhere these days. And so what we like to do is encourage patients to recognize that the quality of care right here in Worcester County is excellent. It's second to none. We have some incredibly great academic surgeons at UMass that have published incredible studies and have just done remarkable work. Same with Reliant, same with Shields. And they're all nationally, internationally recognized. And so what we're able to do is take that same great high-quality care, just put into a little bit more of a cost-effective, high-efficiency model in which the patients are seen for what they need, how they need it, are taken care of from a more personalized manner. And so we encourage all patients to take a look at that. Ask your providers about ambulatory surgery if you're eligible. And if you are, then ask them who they might refer you to, your primary care physician, who they might refer you to, or take a look at our website of the surgeons that we have, and choose to come to the surgery center if that's something that you're comfortable with.
Great. So. Thank you so much, Fred.
Thank you. Appreciate it. Thank you.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.